A critically ill patient is being cared by nurses who has no energy to empathize with the patient's situations, finds no satisfaction or fulfillment in their career, with deteriorating professional performance and possibly at risk to make errors, in which safety is compromised. This is a possible scenario that could happen when a nurse is experiencing burnout symptoms. Burnout is a physical and psychological exhaustion due to stress-related work environment, and it has been shown to affect anyone in any working situation. It has three classic symptoms: exhaustion, alienation from work-related activities, and reduced performance. Currently, there are only few studies made with a concern for burnout in the Philippines. Further, there is a scarcity of information for its prevalence and influencing factors, especially among nurses. However, in recent international studies, occupational satisfaction, working environment, and temperament have been associated or linked with burnout. Therefore, in this study, the same variables will be considered as a determinant of burnout among Filipino nurses. The results of this study hope to promote awareness of burnouts among our frontline healthcare workers. And through that, prevention may be implemented and interventions should take place to improve the quality work in the healthcare. This study aims to increase the information more about the determinants associated with burnouts. Here are the objective questions. Number 1, what is the occupational satisfaction of the respondents? Number 2, what are the characteristics of the work environment of the respondents? Number 3, what are the temperaments of the respondents? Number 4, what is the extent of burnout among the respondents? Number 5, is there any significant association between the following variables and nurses' burnout, which are A. Occupational satisfaction, B. Working environment, C. Temperament. Number 6, is there any significant difference in nurses' burnout in these terms? A. Age, B. Gender, C. Religion, D. Marital status. This study will be using the descriptive-correlational method of research. The descriptive design will be utilized because the study will describe the determinants and levels of burnout among nurses. Furthermore, correlational analysis will be employed in order to determine relationship or association among selected independent variables against a dependent variable. Analysis of the data. Mass-like burnout inventories assessment tool for levels of burnout will be used to determine the levels of burnouts from the respondents. It will address 3 different scales of burnout: emotional exhaustion, depersonalization, and personal accomplishment.